And at the global level, the number of infected cases by COVID-19 is more than 3 million, Kun Thepchai. And in the US alone, the number of deaths is more than 57,000. And if we compare with another country like India, probably is very mysterious because in India, the number of deaths right now is only 1,000. What's happening there right now? We have Kun Nad Bunnag joining us. So Kun Nad,
Hello.
Yes, what really happened with India? Why the death is so little, like 1,000 cases?
I think this question will still remain a mystery for at least a couple of months here because as we all know that India has such a huge population of 1.3 billion people, but how come they only have 1,000 deaths? So I came across this article from CNN here. So if we only look on the surface only, we can say that the Indian government was quick to react towards the pandemic. So when they announced a lockdown on March 24th, they only had 500 cases of COVID-19 at the time. So we might be able to say that they are quick in terms of responding to the outbreak. Compared to other countries like in Italy, when they announced the lockdown, they already had more than 9,000 cases, or even in the UK, they already had over 6,000 cases when they announced a lockdown. But in India, they announced a lockdown when they only had around 500 cases. So maybe we can say that maybe it's because how quick they are with the way they responded and how they took action.
How they make a decision is quite interesting because right now all over the world we see how many countries, many countries have eased the restriction, eased the lockdown. But India reversed.
Yeah, they sort of reversed here because they extended the lockdown to 3rd of May, which is only next Monday here. So we can see that India is taking very, very seriously in terms of curbing and preventing the spread of the coronavirus. So, and we can say that in India, we can in many ways they have tried really hard to handle the situation. Even before they announced the lockdown, they even handled the situation by banning all international flights coming into India, or even passengers that are coming in, they also ban tourist visas as well. But there's one problem with the lockdown though. Remember how earlier this month we talked about Laurie Garrett, who's a journalist who has been highly experienced in reporting epidemics here. She once made a comment about India. When you announce a lockdown in such a short notice and having such a huge population, what really happens here is that people will scramble and rush to bus stops or train stations. So that is where the virus can spread. So she once mentioned that if you announce a lockdown within such a short notice, what happens is that when people are crowded to certain areas, public areas to be very specific, if someone has a virus, it will spread very quickly. And in such a situation, you don't know who has the virus. So if we end up at a bus stop trying to rush home before the lockdown is in place, we might get COVID-19 before we even get home here.
So it must be quite puzzling because with the number of population in India, could not it 1.3 million, but the death is 1,000. So what's the explanation on this very low death rate?
There are two things that the medical experts have been thinking about. So it's either there's some sort of problem with the testing or the registered deaths here. So let's start with the testing first. According to the health ministry in India, they claim that they've already conducted more than 625,000 tests as of Sunday, and 4% of the tests are positive. But however, India's testing rate is very low per capita, which is only around 48 out of every 100,000 people that have been tested. Compared to other countries like in South Korea, their testing rate per capita is actually 1,175 and 1,740 in the US. So we can say that the testing rate is very low in India. And at the same time, medical experts have also suspected that India might have only tested those who already have serious conditions. Unlike in other countries, they also have to test those who are showing symptoms and those who are not. So we might be able to say that India might have a biased testing when they're testing for COVID-19. And what is more interesting than the testing here is the registered deaths here. Based on the article, it actually said that even when India is not facing a pandemic, only about 22% of all registered deaths are medically certified. So that means the other percentage are not certified by a doctor here. And there has already been cases that the deaths that were sent to the hospital were not even tested for COVID-19. So these are the two things that the experts are suspecting here.
So it must be quite a challenge, Kun Thepchai, for a country with large population like India to cope with COVID-19 and have all the testing for people as much as they can. That's quite challenging.
Yeah. So far, India has defied all the predictions of a worst case scenario. There had been prediction that millions would die, but so far, Indians has been able to hold up and at least for the time being anyway, has been able to contain the spread of the virus to the extent that we did not expect to see. But of course, I mean, it's still too early for the Indians to pat themselves in the back because we still need to know the full extent of the infection before we can really say whether the containment strategy by the Indian government has been successful or not.
So I think the question right now here is that, is it okay for India to lift the lockdown on 3rd of May, or should it be extended? Because there are so many factors to think about when we're going to ease a lockdown in such a country that has a lot of population there. Because like in other countries, they have a lot of deaths. They already have a lot of infections. But some of them already decided to ease the lockdown when they found out that the new infections are decreasing day by day. But for India, might be some sort of exception or something that has to be reconsidered a lot because of the population. And considering that India, there are many states around and some of them are rural states. So the health system might not be up to standard for certain areas. So if you're going to ease lockdowns now, then it's something you really need to reconsider at the moment.